Have you ever been in a doctor's office and felt kind of like just another number, like a task on a checklist? Well, that's exactly what we're talking about today. We're diving into a really big shift in medicine, moving away from that impersonal feeling and towards something called personalizing healthcare. So let's set the scene. I want you to picture a super busy hospital. You know the vibe. Doctors, nurses, they're all rushing around, charts in hand, phones are going off. It's all about efficiency, right? Every single second counts. And right in the middle of all that chaos, one professional notices a colleague. And, the care they're giving is, well, it's technically perfect, but it just feels cold. Each patient is being treated more like a puzzle to be solved, a case study, instead of an actual person who needs care. And seeing this, it sparks a really important question. And that brings us to the core question for this whole explainer. Why should healthcare even be personalized? I mean, isn't getting the science right, the diagnosis, the treatment, isn't that what really matters? Well, as we're about to find out, the answer is a whole lot deeper than just having a friendly bedside manner. All right, so our first section is called More Than a Case Study, and the idea here is about redefining the meaning of healing. This is where we start to unpack what's really going on when a person gets sick. So where does this problem even come from? Well, it's kind of ironic, actually. As medicine gets better and better, more specialized with an expert for every single organ, we've accidentally created this side effect, depersonalization. It wasn't on purpose, of course, but it's a very real consequence of modern medicine. And this really gets to the heart of it. On the one hand, you have the impersonal view, which sees a patient as, and I'm quoting here, a collection of organs to heal, a case to study. But on the other hand, there's the human view, and that sees a human being to make whole, a person with a life. That's not just a tiny shift, right? That is a complete 180 in perspective. And it's so interesting when you look at the word healing itself. Its original meaning is literally to make whole. So from the very beginning, the idea wasn't just about fixing a specific broken part. It was always about restoring the entire person. And that makes so much sense because, think about it, illness never just affects one little part of you, does it? It touches every single aspect of your life. The slide lists them out. It affects your physical well-being, your emotional well-being, your psychological well-being, your social well-being, and even your spiritual well-being. A health problem is really a life problem. Okay, so if the goal is to heal the whole person, how do we actually do that? Well, that brings us to our next section, the patient as partner. And the subtitle says it all, shifting from passive recipient to empowered individual. This is the solution. So, the goal of personalized care really has a few key steps. First, you have to see patients as active individuals. Second, the job is to assist them in freeing themselves from whatever is holding them back. Third, and this is huge, you empower the patient. And finally, number 4, you avoid creating dependency. It's all about giving that control back to the person. What this really means is that a practitioner's job goes way beyond just the science. They have to look at the patient's general well-being. That includes their needs, their rights, their life, everything that's happening outside the hospital walls. Again, it comes back to seeing the whole person, not just the disease. Now, you might think all these benefits are just for the patient, but it's actually much bigger than that. And that's what our next section is about, the ripple effect of care. We're going to see how personalization actually benefits everyone. So who gets a piece of this pie? Who benefits? Well, first, there's the patient, of course. They receive holistic attention for their general well-being. Then there's the institution, the hospital or clinic. It builds support and a great reputation when the public is satisfied. And finally, there's the personnel, the doctors and nurses themselves. They get to create better relationships and avoid all that strain. It really is a win-win-win situation. And if you need any more proof that this stuff matters in the real world, just listen to this quote. Many lawsuits arise not only from objective complaints about medical effectiveness, but also on subjective dissatisfaction with the physician's attitude towards the patients. Wow. Let that sink in. We're not talking about medical errors here, but about attitude. How a patient feels they were treated can lead to massive legal and financial problems. This shows that attitude isn't some fluffy soft skill. It's absolutely critical. So this brings us full circle, right back to a really fundamental question that I want to leave you with. Is the ultimate goal to cure a disease, or is it to heal a person? Because as we've just explored, the answer to that question, well, it changes everything.